TD to respond to the debate.
Thank you very much, Chair, and woman to woman, best of luck in the afternoon. Could I just maybe start with the last motion first, and Jerry, whom I have the deepest respect for as a campaigner in relation to disability, for disability all his life, from a very much a lived experience and a personal experience, and you can't dismiss that. I'm not certain that any of us that don't live that experience every day can ever fully understand, but we can just try. The motion itself, it doesn't go as far as Jerry's remarks in relation to it, and I will just simply respond to the motion. There is a perception that disability services have been disproportionately affected by successive cuts in recent budgets, but it's not the case. I have worked along with Brendan Howlin, and I would have to say at this stage, and I know ministers or politicians are not inclined to give credit to others, but I would have to say that if it weren't for Brendan's continued support, we would not have been successful in protecting the disability budget in the last 2 years, and I think that he has done an incredible job. Just to give you a little bit of an example of what I'm talking about, in last year's budget, not this present budget, because we're still, as you know, in health, there are two budgets. There's the budget and then there's the service plan, which is the one that really takes probably more work. But last year, for instance, right across government, there was a 5% cut, disability at 1.2. And I think that was some achievement in a time when people were crying out for us to get our finances in order, considering the mess that we were left with and that we inherited. So, you know, we are doing our very best. I dread to think what would have happened if we were not in government, and I believe that people with disabilities would be simply marginalised and put where they have been for a number of years as sort of superfluous to what society needs. I don't believe that. I don't believe that. I believe that people with disabilities, and that will include each and every one of us as we age, will acquire a disability. And I believe that they have to be central, and we have to be central to not just what society needs, but also to the contribution that people can make. And you heard Jerry here today, and I think his contribution is something that we have to take into account, and people with disabilities all over the country can make that contribution. In relation to fairness in the health service, Central Council, what is the Labour Party about if it's not about fairness? I mean, you know, why are we here if it's not about fairness? Surely that is the continuous struggle. I mean, if it's not fairness in terms of employment, education, and most especially in the health service. Alex has laid out the new vision for health. And the new vision for health is not just about the acute hospital and the GP. It's not about that. It's about far more. It's about how we think, what our mental health is, how we encounter the environment. It's a holistic approach, because we are living longer and we will stay healthier. And that is a challenge in itself, but only a challenge if we don't plan for it. And that's really what this is about. It's about the planning. It's about the gathering of data, the information. It's about all of that. It's about ensuring that we know where we're going and that we have the means to get there. We've taken $3 billion out of the health services and over 10,000 people, and it's still standing and still delivering a good service. I think that that is a credit to this government about bringing things back into line, but also ensuring that when you are sick or when you need the health service, that it is there and available to you. We have a long way to go. We have a long way to go in terms of medical cards, but it's not just about medical cards for people who have a difficulty. And yes, that is an issue and something that we work on every day of the week. But it is about ensuring that everyone has access to their GP in primary care. Because the notion that you continue to go to the acute hospital for every single service is ridiculous. It's absolutely ridiculous. Primary care is where we should be delivering the majority of our health service, and that's what Alex White and myself are about, and we have persuaded the Department of Health that that is the direction that we're going in. Oh, by the way, there was one thing that Alex left out, and I would be stoned if I didn't say it at this stage. Barry Desmond was Minister for Health as well. He's from Cork. All our ministers of health were not from Wexford. And they were all good. Our maternity services, yes. How could I disagree? How could I disagree as a grandmother since last Friday again? How could I disagree that our...
Kathleen, I'll ask you.
I won't be long. Actually, that one I had very little to do with. But even though I will take the credit in the future. But let me say that our maternity, of course, I mean, it is fundamental to what we are, how we deliver, you know, the next generation. That is fundamental to what we are, and it is something that we must continuously allow women to have choices in. And you know, partners, husbands, fathers are now asking to be involved as well, and I see very little wrong in that.
Thank
so
you,
we
Kathleen.
will very much take on board it. Could I just, Lorraine, and I beg your pardon, and that's why I complimented you at the start. Could I just, in terms of palliative care and the hospice movement, we have for the first time ever, and it is the only All-Ireland organisation that works now both north and south, and that is the hospice movement. And I've had huge interaction with them. Recently I had a meeting with Minister Poots about how we can learn from one another. And yes, it is essential that every county has beds in relation to palliative care and hospice delivery. But even that concept is changing. You know, the notion now that everyone has to go into the acute bed in the hospice space, you know, whereas we need few acute beds, but really the delivery of that must be in the community and where people feel comfortable and safe.
Okay,
and at the
Kathleen.
end of the day, what do we all want? Only to remain entirely in our own homes. I recommend the motion.
Thank you very much, Kathleen. Thank you.